In 2014, Gainesville Fire Rescue started a Community Resource Paramedic Program. We have seen a significant increase in 911 call volume. There has been a 56% increase over the past 10 years of 911 calls going up, with just a 13% increase in our population here in Gainesville. So that tells us that there is a problem. People are cycling back and forth from their homes to the emergency room. Their medical symptoms are getting treated, whereas their social problems were going untreated.
Community paramedicine is a newer model for community-based healthcare. Unlike other approaches, it relies on the emergency medical system, specifically medics and EMTs, to deliver those services in the home and in the community.
As first responders or paramedics and firefighters, we have a chance to go inside people's homes where we can really get firsthand knowledge that they're struggling, whether it's with a social issue or managing a medical condition.
We get referrals from our firefighter crews when they go out and run a 911 call and identify that a patient needs some sort of social service assistance, or maybe they don't have a primary care doctor. They would send a referral to me and we'll go and do an assessment. We also collaborate with 4 UF Health clinics, so all of those primary care physicians can refer patients to me as well. When does she take those?
Once a day.
At nighttime?
Evening, yes.
What's really fascinating about our program is that in addition to having obviously staff from City of Gainesville, from Gainesville Fire Rescue, and then now also having input from faculty such as myself at the university, we also have a small army of student interns from the university that really provide substantial manpower for the day-to-day operations of the program.
We have a very unique program in the center. We have the only undergraduate academic program dedicated to health disparities in the entire nation. So this project was a unique opportunity to involve students in community-based learning so that they could see the application of everything they're learning in the classroom in a real-world setting. They've been the boots on the ground to help connect people in the CRP to the medical and social services needed.
We went in to do a card sort activity, which is an objective needs assessment. We'll go in and figure out exactly what we need to help them with. And then from there, we'll do a medication reconciliation. We'll take inventory of all the medications that they do have versus what they should be taking as prescribed by their physician. And then we'll bring that back to the physician and say, hey, they didn't have these medications, or maybe they're taking them wrong. We report our findings back to the physicians as well as the investigators on the grant, so Dr. Geyer and Dr. Chaco.
Our initial findings show that working intensely with people in the community in this way, matching them with services, identifying those underlying needs, does impact their use of the 911 system, of the healthcare system. So we saw decreased rates of the ER use, we saw a decrease in hospital admissions, and then what makes me very happy is that we saw increased use of primary care and patients were less likely to cancel or miss those appointments.
I also want to have them take the responsibility of their own health rather than calling 911 to solve their problems. And we've been doing that. We've been successful at that. And it's amazing to see the change in the person as we help them rewrite their narrative. So they're no longer sick patients. They are productive members of our community here in Gainesville.
I'm grateful. I'm thankful. We're grateful. And she was able to pick up some things that I couldn't pick up. You know, even though I'm here all the time, she was able to see things that I couldn't see.
I love what the university and city are doing, working together in this way. To me, it just makes sense. We have all this brain power, expertise, energy on campus. We absolutely should be using that to benefit our community. And so I'm pleased to be a part of it. I'm pleased to have an outlet for my work. And I absolutely will continue to advocate for that partnership.
Jesus, I'll never forget.